Hello everyone. So today we will discuss about the most talked about virus, which is HMPV virus, also known as human metapneumovirus. And we will see, is it a really new virus or is it an old one? Is it really very deadly or is it not? So let's start. So it is basically a respiratory pathogen. That means this virus attacks the respiratory tract of the people, and it was first described in 2001. So for sure it is not a new virus. It was known since 2001. It belongs to the family Paramyxoviridae. So this virus is from Paramyxoviridae family. How it was detected? Actually, it was detected by a technique called polymerase chain reaction, which is a molecular method, and it was detected in children that who were having respiratory symptoms or respiratory illness, but they were coming out to be negative by other viral tests. So in these children, this virus was detected first in 2001. So what is the prevalence? It is a widespread virus, and it is said that 100% prevalence is there in young adults as well as older people. So our first question, that is it a new virus? Obviously not. No, it is not a new virus. It has been detected earlier and it has been in circulation even in India, and most children get it before turning 5. So it is not a new virus. It is there already in circulation. So here you can see how a report of human metapneumovirus looks like. This is a PCR report, and here you can see in the detected there is human metapneumovirus, and this is an old report from October. This is not a new one. So basically the illness varies from mild upper respiratory tract infection, where we all have a common cold like symptoms like fever, cough, sore throat, runny nose, breathlessness. Breathlessness means difficulty in breathing, but it may lead to severe lower respiratory tract infection or pneumonia in some people. So the symptoms are basically similar to RSV or respiratory syncytial virus, which is also in circulation and has been in circulation earlier also. So we can say that the illness can vary from mild to severe depending on the population it is affecting. So we see that the symptoms are usually mild like any other respiratory tract infection or common cough and cold, but it may get severe or aggravate in those who are very young children, in patients who are elderly and immunocompromised. Immunocompromised means the immunity of the person is not very strong due to some reason. So respiratory tract infection may become severe in adults with hematological malignancies, that is blood malignancies, lymphomas, which is the malignancy of lymphoid tissue which generate antibodies, and admitted elderly patient means institutionalized elderly people who are very old in age. How can we prevent it? So basically, just like COVID, it also transmits through droplet. Droplet means the droplets that are formed during coughing or sneezing from a patient. They have a tendency to enter our respiratory tract and cause infection, and also by direct contact. Again, if the person's hand is infected with the droplets of the virus, then they can transmit it to the other people. So obviously the prevention becomes face mask just like COVID, and also hand hygiene. In hand hygiene, we should note that if we are using alcohol based hand rub, it should be in contact with our hands for about 20 to 30 seconds, and if we are doing soap and water hand wash, then it should be for about 40 to 60 seconds, that is approximately 1 minute. So how can we diagnose this virus? This virus is basically diagnosed by PCR or molecular method, and the sample is collected is similar to that of the COVID, that is a nasal or a throat swab, or we can say nasopharyngeal or oropharyngeal swab is collected, and then it is subjected to a molecular method that is called polymerase chain reaction, PCR. So what kind of treatment do we have? There is currently no antiviral, as like with other viral infections or viral common colds. There is no currently vaccine available. Antibiotics are basically not needed, since antibiotics act on bacteria and not on viruses. Only in those cases where this viral infection has led to some secondary bacterial pneumonia or secondary bacterial infection, then your healthcare provider may give you some antibiotics to overcome that secondary infection, but that should be taken only under the supervision of a healthcare provider. As with other viral infections, plenty of fluids do help, so keep yourself hydrated in case you get any kind of viral infection. So the answer to, do we need to panic? So as of now, no, there is no need to panic, but it is difficult to say what will unfold in future, if the virus will mutate or not. But the virus that is present now is already been circulating, so it is not a new virus, it is an already known virus, and children have already been infected with it, and most of them must have been infected before the age of 5 years. So there is nothing new about it. But if the virus mutates, if this will take the shape of an epidemic or pandemic is too early to say, but we need to stay safe and stay alert and follow the precautions in case we or any other person get infected with any common cold virus. Thank you. Stay safe.